For Ann Kellams, the idea of practicing medicine came naturally to her at a very young age.
So I'm told by my parents that I was still in diapers walking around saying I wanted to be a baby doctor. And that could have been brainwashing from my father, but it's all I've ever wanted to do. The moment I remember is at medical school graduation, just being so excited and happy, but the moment that we all stood up, and I'll probably cry thinking about it now, just like being, I can't believe I did this and lived this dream, and that this is going to be my work. I'm so lucky.
It is also natural for a mother of a newborn baby to want to begin her relationship with that child by breastfeeding.
What makes the most difference in the health outcomes of babies in terms of risk factors that are amenable to change? The things that come up are breastfeeding and safe sleep and smoking cessation.
12 years ago, when Dr. Kellams arrived at UVA, only 20% of new moms who wanted to breastfeed were breastfeeding. The rest were using formula, even though they didn't necessarily want to.
When we started diving into the evidence about what helps them and how many moms should need formula, etc., we realized that a lot of the practices in the hospital weren't best supporting these mothers with their own choice to breastfeed. So it's not about forcing or telling them how to feed, it's helping them be successful with what they chose and what could we do on our end.
Dr. Kellams knew it would take a cultural change. She likened it to climbing Mount Everest.
Oh my goodness, it's multifactorial, starting with recruiting a huge team, OBs, family doctors, the nursing staff, the hospital administration, everyone has to be on your team. The next piece was, how do you incorporate this practice, these changes into an already busy and stressed and, sometimes chaotic and overwhelming system? One of the things I did to help our physicians get on board with some of these changes was teach them what I have learned since becoming a certified lactation consultant, tips and tricks that I've learned along the way. We're all passionate about doing the right thing for our patients, but if it seems like an extra thing that someone's telling you to do, that's different than if I am taking care of this mom and baby, this would be the best way to do it.
As part of this endeavor, Dr. Kellams created the Breastfeeding Medicine program at UVA, helping moms work around obstacles that can prevent them from breastfeeding.
We also have an outpatient clinic that has grown over 300% since 2012. Those visits are paired with a pediatrician and a lactation consultant, so they are covered by insurance.
The result of this 12-year effort is twofold. First, breastfeeding rates among women who choose to breastfeed rose from 20% to nearly 80%. Secondly, Dr. Kellams has transformed the culture at UVA Hospital to ensure this legacy will continue long past her time here.
It feels like a privilege. It gives meaning to everything that I do, to think that something even small that I did or helped start or helped work on can affect what happens in the future, and not just for this institution, but for mothers and babies. Thinking about all the people that we're training that are coming through and seeing this evidence-based care, and they're going to go out and help people too. So it's amazing.